The fourth cause that I would like to talk about is cardiac issues. Specifically, a right to left shunt. What do I mean by that? If this is your heart, remember that your left side basically goes to your systemic circulation. Your right side goes to your lungs. If I had a pulmonary embolism that's affecting my lungs, I'm increasing right-sided pressures. If I had a hole in the heart, think about it. If right-sided pressures are increasing, blood would go from right to left. That's obvious. Instead of left to right, because the pulmonary embolism would increase right-sided pressures, not left-sided pressures. Now keep in mind that if deoxygenated or blood with less oxygen is going from right side to left side, eventually this blood will go from left to the systemic circulation, right? Because you're basically adding mixed blood into the left side of the heart. And remember, the left side supplies the systemic circulation. In other words, you're causing hypoxemia, aka eventually you're having decreased oxygen in your arteries. And that is because instead of blood going from the right side of the heart to your lungs, it went from right side to left side through a hole in the heart because there was increased right-sided pressure through a pulmonary embolism, for example. And that caused mixed blood to enter your systemic circulation, leading to hypoxemia. So this is classically your Eisenmenger syndrome. And that is the only cardiac issue that I am aware of at the moment that would cause hypoxemia in the blood or decreased oxygen in the blood. Let's move on to the last cause. The fifth cause. And this is your VQ mismatch. And I know you guys are getting worried by hearing that word because it's a hard concept, but I'll try to simplify it. If this is your alveoli, this is your arteries, this is your V, and this is your Q. What does that mean? V is ventilation. In other words, how much oxygen is ventilating the alveoli. Q is blood flow. In other words, how much blood is going through the vessel passing near the alveoli. So a VQ mismatch is anything that affects V, or ventilation of the alveoli, or Q, perfusion of the alveoli. What do I mean by that? If I gunk up this alveoli with material such as consolidation or fluid such as edema, oxygen has a hard time getting through all this gunk and into your blood vessels. So anything that gunks up the alveoli will cause a VQ mismatch, particularly issues with V. And this is your consolidation or your fluid. This would be your pneumonia. This would be your pleural effusion. Fair enough. Let's move on to Q. We make that drawing again. Your blood vessels, Q, V. Oxygen is trying to enter, and oxygen can enter in this case because there is no issue with ventilation now. But the issue is with perfusion, aka you have something that is obstructing blood flow and preventing blood flow from entering this region. Now what is that? This is your pulmonary embolism, aka if you block the blood flow, no blood can enter this whole area. This whole area is dead because there is no blood flow. We call this dead space. And what is dead space? It is an area where there is perfusion, but there is ventilation, but no perfusion. In other words, oxygen is entering, Oxygen is entering. This is full of oxygen, but it can't get into the blood because there is no blood here, because it is all being blocked by this embolus that is creating all this dead space, in a space where there is ventilation but no perfusion. So this is something like a pulmonary embolism. And that would cause the Q of the VQ mismatch. So those are your 5 issues. I don't know if you can see the drawings right here as well, but again, let's bring on a pointer. This is your first issue, which is number 1, you have decreased oxygen in the alveoli. Number 2, you have hypoventilation of the alveoli. So number one, decreased oxygen was there's less oxygen in the environment, so less oxygen reaching the vessels. Number 2 is hypoventilation. In other words, you have a decreased want or drive to inspire, so decreased oxygen in the lungs, or you have the decreased capacity to inspire, so shallow breathing, not having enough oxygen in your lungs. Either way, less oxygen in your lungs, so less oxygen in your vessels. Number 3 is diffusion issues, so something that gunks up the membranes, thickens the membranes. So for example, interstitial lung disease, or issues that affect the alveoli such as emphysema or respiratory distress syndrome. Then you have your cardiac issues, and cardiac issues will be specifically your Eisenmenger syndrome, where you have a right to left shunt. In other words, you have deoxygenated blood going into your systemic circulation. Lastly, you have your VQ mismatches, and this is, for example, when you have an issue with V, where the alveoli is gunked up with fluid or consolidation, such as pneumonia or pulmonary edema, and oxygen can't get through all this gunk, so it can't enter the vessels. Or you have a blockage of the vessels, so there is increased dead space, and perfusion is fine, but oxygen can't enter the vessel because the blood flow is restricted. So those are your VQ mismatches. I hope that's clear so far. Let's get back into the question. So what is the answer right here? Is it altered alveolar ventilation? You could say that, but it's not the main issue. The main issue is increased dead space, because we've already discussed that what pulmonary embolus does is it affects Q, or it affects perfusion, and that's why you have a VQ mismatch, and that will eventually cause hypoxemia. And if you have decreased oxygen in your blood, you'll have decreased oxygen in your tissues, and eventually that will cause death. Let's go through the other options, though. It's not altered alveolar ventilation, because it's nothing to do with all the concepts that we've discussed so far. Increased left to right shunting. No, this is wrong, because we've already discussed that one of the only things that will cause hypoxemia in terms of cardiac issues is a right to left shunt, not a left to right shunt. Lastly, normalized AA gradient. This is not a thing, because AA gradient is something that affects diffusion. We've talked about the things that thicken the diffusion barrier, but keep in mind that VQ mismatch can technically also affect the AA gradient, because you're basically making diffusion harder, and that is what the AA gradient represents. But in that case, AA gradient would be increased, not normal. So it's not D either. So everything is wrong. C is the correct answer. I hope you liked this video, and if you did like this video, please share it with other people who might need to know this concept, and let us know what other concepts you'd like us to discuss. I know this was a longer video, and I'm sorry about that, but these were important ideas that you have to know, and hopefully this will make pulmonology a little more easier for you guys. All right? So with that, we can end this video. This is Dr. Shah signing off. I hope you enjoyed.